Well, good afternoon. It's great to be back in Northwest Florida. I want to thank Tom Van Osdal for having us here at Sacred Heart. Obviously, we've worked with Tom also with their facility in Jacksonville. We also have Dr. Jason Folan, pediatric intensive care pediatrician in chief. Dr. Pete Jennings, Chief Medical Officer here at Ascension Sacred Heart, and then Don Rudolph, President of Ascension Hospital. So we really appreciate you guys coming. I'm going to give an update on what we're doing, what's going on in Florida, and then we will have a little discussion about some of the things they're seeing here in Northwest Florida, and I think that they'll offer some pretty interesting insights, so we look forward to doing that. Here's what we've been seeing in terms of the cases that are coming in. And I know there's a lot of discussion about number of cases and all this. And while the number of cases is something that you look at, what we've always looked at is the positivity rate of those cases. And the reason for that is for every case that's detected through a positive PCR test, there are probably 10 other infections out there. The CDC recently came out and said they believe that 10 times as many Americans have been infected as have actually tested positive. So that would mean instead of 25 million or 2.5 million, closer to 25 million. There's other folks who've looked at the seroprevalence studies and think that number may be closer to 40 million. Whatever it is, I think everyone would agree that a positive test, the number of cases you detect, is not the sum total of the infections that you have throughout the community. And so if you test 25,000 people and your positivity rate remains stable, then you can double the testing capacity. You'll probably double the tests. Not really anything that would be unexpected. And so that is just something that's very, very important. What we've been doing, if you look at the slide, we were pretty much in that 10% range for positivity when we really started to ramp things up in March and into April. Now, we weren't testing nearly as much as we are now. Back then, you were pretty much testing people who were symptomatic, and usually people who were 65 and plus, sometimes a little younger than that, but that was really focusing on testing the folks who were going to be most vulnerable to the illness. As we got into April, we started testing more, but we also saw the positivity rate drop. And then really from the beginning of May through that first week of June, we were pretty stable, between 3 and 5% positivity. And so as we would increase testing, you would have some more cases, but the cases were very stable, very manageable. And then what we started to see as we got into the second week of June, and then now certainly over the last 10 days, yes, we're increasing testing. As you see in this past week, we've done more testing than we ever have by far. That May 17th week where you see the 243,000 tests, that was about 5 weeks worth of backlog negatives that got dumped that week. So we were not testing that much in that actual week. It was pretty much a consistent increase, but really jumped here in the last week to 10 days, which is a good thing. When you do that, you are going to find more cases because the detected cases are just a small fraction of the total amount of infections. But we have seen the positivity rate increase from the May standby of 4 or 5% to now 6/14 was almost 10% and now 12% with that. So when you see an increasing positivity, yeah, you're testing more, but you're finding more cases at a faster clip than if that positivity was stable. So that is something that we're really looking at, and as we're looking at all the different communities, seeing how that's going on, that positivity increase is really being driven by a big increase over the last 3 weeks in individuals testing positive throughout the state of Florida in younger age groups, particularly 18 to 44. And if you look at that 25 to 34 age group, that is now by far the leading age group for positive tests in the state of Florida. And that's something that's pretty new. Now, part of it was We weren't really looking for cases in those age groups when we were doing this in March and April, because as you see there, they're much less likely to see significant clinical outcomes, much less likely to be hospitalized, and way less likely to suffer a fatality. And yes, those fatalities are not all caused by COVID. They're fatalities with COVID, and so it does include more than just ones at that, but still, even with that, you still see the numbers in those younger age groups compared to the number of positive tests, very low fatality rates. And so you're seeing it in those groups who are less at risk, but you're seeing them test positive at much higher rates. I think 25 to 34 has been pretty close to 20%, and we're seeing it all across in the different areas of the state. This is the one kind of consistent thing. For most of this, you kind of had a South Florida story, then you had some other parts of Florida. Northwest Florida has always been, relatively low and stable. You are seeing South Florida, again, and Miami obviously has the most cases, but this is something that we're seeing, over and over. And basically, I think from talking to folks, this is basically socializing. You have graduation parties, you're going out, you're doing different things, and in certain environments, that's going to be conducive to transmitting the virus. So here is the breakdown. Where our cases are coming from, by and large, are in the less risk demographics. But as you can see, as you get into the particularly 75 and up, the infections, fatalities per infection, much higher, of course, than in those younger age groups. And so part of what we want to do is continue to do things that I'll mention, protecting the long-term care facilities, obviously advising the senior citizens to limit contact outside the home as much as they can. But for these younger groups, they need to be thinking about who they're coming into contact with who may be in the more vulnerable groups, because you've seen this thing spread amongst them and their cohort, and if it spreads to the folks who are more elderly, that's going to result in negative outcomes in terms of health. What we talked about in March, the whole mantra was flatten the curve. We were able to do that here. There was dire predictions of running out of hospital space by April, and running out of ICU and all this stuff. That didn't happen. We had abundant capacity, and so we were able to do that and clearly beat the expectations of what people had said. Part of the reason you did the flatten the curve is because you wanted to make sure that the healthcare system would have the capacity to deal with infections as they came down. And you knew that there were going to just be infections. If you spread them out over a longer period of time, then you're in a situation where you can handle that better than in a place where the infections just run wild and it overwhelms the system. So, and I think you can see in June where we're at, much better than where we were in March. In March, we had 7 state-supported testing sites. They did about 20,000 tests amongst them over those weeks in March. Now we have 41 various testing sites, drive-through sites, pop-up retail sites, walk-up sites, mobile RV, and they've done close to 500,000 people now in the state of Florida. And so when we did the phase 1, we put more testing sites around because we wanted people to be able to get tested, including one here in Northwest Florida. And so that is night and day. When we were doing this in March, if you were somebody who was 30 years old and you had been exposed but didn't have symptoms, there is no way you would have gotten a test. They just were too scarce. Now people, even if they don't have symptoms, are able to go to a drive-through site and get a test. So we're in a much different spot in terms of that. Also PPE, one of the reasons why people were concerned about stress on hospitals was, yes, the patients coming in and did you have enough capacity and beds, but also this PPE was in really high demand. There was a worldwide crunch on the supply lines. That has since loosened up. All the hospitals are in a much better shape. The Department of Emergency Management here in Florida has sent huge amounts of PPE out to various healthcare workers and first responders, including more than 40 million masks and over 12 million gloves, as well as 1.7 million face shields. So in terms of the PPE, we have the PPE. Hospitals are in a much better spot with that, and then they're going to be able to handle patients as they come in a much better way. Also, some of the treatments we now see in COVID-19 recently, things like convalescent plasma, the remdesivir that we helped get down from the federal government, sent to all the hospitals, and then other types of therapies, whereas before it was try to put as many people on ventilators as you could. Now you have other ways. I think the physicians have really learned a lot, and then you're also in a situation where, we just have way fewer people, that need the mechanical ventilation now, as opposed to in March and early April, which is a really, really good thing. So learning about the virus, learning about the disease, and I think the folks throughout the state of Florida and the medical profession have really done a good job. And then we're also in much better shape with our long-term care facilities. Now, we did recognize this very early as something that was potentially a weak spot in terms of having a lot of vulnerable residents there to this virus. So we acted very early, working with the long-term care facilities, making sure that they were screening their staffs, banning visitors, and then banning hospitals from sending COVID-positive patients back into long-term care facilities early on in the pandemic, requiring mask and PPE of the staff who are going to interact with the residents and the state of Florida, because look, a lot of these facilities were just not necessarily prepared for this. The state of Florida has sent more than 10 million masks just to long-term care facilities. I think over 500,000 face shields just to long-term care facilities. And so this was something that was a vulnerability, and we wanted to do all we could to help protect those residents. We also started something in April and have now really expanded it, having COVID-dedicated skilled nursing facilities, so that if you have an outbreak at a nursing home and you're not able to properly isolate the patient, maybe that patient doesn't need hospitalization in terms of their level of acuity, but they do need to be isolated. And so you now have these dedicated facilities. There's one right here in Pensacola. We have them in different parts of the state where these folks can be transferred so that they're not spreading the infection in their nursing home. And that is really something that we didn't have available in March. We now have a lot of that available throughout the state. We've also now, anytime you have a resident of a long-term care facility in a hospital, regardless of whether it's for COVID, they need to be tested regardless of their symptoms before they're discharged back to the long-term care facility, because we're concerned about somebody maybe being asymptomatic and then bringing it back and then spreading it amongst vulnerable residents. Now we went through, I had the National Guard and these strike teams going to nursing homes, testing the residents, testing the staff. It took us, because we have over 4,000 facilities in the state of Florida, so it took us about 2 months to get through all of that. Now what we're doing is every 2 weeks, every staff member, employee at a long-term care facility needs to be tested. So we have a system in place where those tests are being distributed to all the long-term care facilities, and we're going to be getting data on the long-term care facility workers, hopefully in real time as they're testing. And this is something that is a mandate and a requirement. That is a way to, if somebody is positive, you can isolate that worker so that they're not interacting with the residents and spreading it there. Nationwide, if you did an honest accounting of how, and not all states have done that, but if you were honest about it, certainly more than 50% of the COVID-related fatalities have been with residents of long-term care facilities. And so that is absolutely our #1 area of vulnerability when it comes to COVID-19. We've obviously done a lot on infection control, helping them as best we can. There's a look at the COVID-dedicated nursing facilities. So you see you have DeLuna Health and Rehab here in Escambia. We have one in Tallahassee. So for Northwest Florida, you have a couple different options. The one in Jacksonville was the first one that was done in April. And now we're going to be opening up one in Miami-Dade County on, I think, July 1st down there at the old Pan American Hospital building. So this is there. Didn't have that 3 months ago, and I think that this will help protect the most vulnerable. And throughout this whole time, 80%, almost 80% of the long-term care facilities in Florida have not had a COVID positive resident, which is, I think, pretty good given how contagious this disease is and particularly how it can pass asymptomatically. They've worked really hard. Obviously, we've tried to support as best we can. And of course, the brunt of the COVID-related fatalities are in that 65 and plus age group, certainly, particularly in the long-term care facilities. And I think one of the messages that we have, we've advised from March and continued to advise on all our executive orders, all our public health advisories for folks who are in those vulnerable age groups or who have underlying medical conditions to limit, to avoid crowds, limit contact as much as you can with folks outside the home, just given that, we're seeing this circulate with young people in particular. There is a vulnerability there if you're maintaining close contact. By and large, the folks here in Florida, the seniors, have been very, very diligent. And I know it's gone on now. We're in the third month of this, and I know it can be tiring. But we would just ask maintain that diligence right now. And if you're in one of those younger groups, make sure that you're behaving in ways that aren't going to put someone who's more vulnerable at risk. We also talk about avoiding the 3 C's: closed spaces with poor ventilation, crowded places with many people nearby, and close contact settings such as closed range conversations. That's just the reality of how this thing likes to transmit. In Florida, and you're seeing cases across the entire Sun Belt, and I'm not exactly sure why you're seeing it there as opposed to other places, but one of the things that I think is a factor is as it gets warmer in Florida, people want to beat the heat. They want to go inside. They want to do air conditioning. So if they're having a party or getting together, they're much more likely to be doing that indoors, in the AC, in a closed space. That is going to increase the risk of transmission of the coronavirus. Outdoor transmission, particularly in sunshine, heat, and humidity, has not been something that we've seen a lot of here in the state of Florida. And I think the data has been pretty clear throughout most of the United States and most of the world that you just don't see a lot of outbreaks tied to outdoor activity. Now, it doesn't mean that they can if you're really close in a really large group. I mean, obviously, we've seen or some suspected that you may have seen some of that, in the U.S. recently. But I'd say from run-of-the-mill activity, outdoors is going to be better than indoors. And now crowded places, none of the stuff in our phase 1 or phase 2, would permit necessarily to have a crowded place in any of these things. But I know not everyone has been following, all the different rules. But just understand that is going to be a situation where you're going to have much more likely to have a transmittal of the virus. And we've seen that with some of the clusters that have been identified, particularly amongst these young peoples. I think some of the folks here may talk about it, but, they'll say, what did you do? Oh, we had a big graduation party for all my friends were over. Well, and then you ended up having a bunch of them end up getting infected. So the 3 C's are something to think about, avoid them as much as you can. And then in addition to that, particularly when you can't socially distance, wearing a facial covering. We've advised that since the beginning of May, including and especially for face-to-face businesses. And I think you've seen that with businesses who do things like hair salons and barbershops. You see a lot of restaurants where the servers are wearing the facial covering and the gloves. And I think that's a good thing to do. I think it gives customers a lot of confidence that you're really putting safety first. Obviously, washing hands. And if you are sick or have symptoms, then certainly stay home. You have an ability to get a test at all these sites, but stay home and don't infect other people. We think that's a responsible thing to do. So that's where we are. I think the increased cases are being driven, a lot of it because you are seeing much more spread amongst the younger demographic. I think that positivity rate, we'd like to turn that and get that going in a downward direction. We are testing a lot more, and so part of this is you're testing in areas you wouldn't have been testing before, particularly in that 18 to 34 demographic. But it's important to identify who may be carrying this so that even if they aren't significantly ill from this, that they don't pass it to somebody else who may end up being more vulnerable to a serious illness. And so I appreciate being here. I want to turn it over to Tom to make some comments, and then we'll let some of the other physicians speak, and then maybe just have a discussion. So.
Thank you so much, Governor DeSantis, and we welcome you to Ascension Sacred Heart in Pensacola. We're glad to be with you again, and we're so grateful for your leadership. You and your team have been exceptionally responsive to our needs and consistently open to our input. We're grateful for everything you're doing to help protect our communities and our families during this unprecedented time. And we thank you for your strong advocacy on behalf of Floridians with the federal government as they provide aid in the form of CARES Act funding. And I really want to take this opportunity to recognize and celebrate our caregivers and our physicians, our associates, and our leadership team across Ascension, Florida and Gulf Coast, including those right here at Ascension Sacred Heart, Pensacola. Their efforts have been extraordinary, and they've gone above and beyond, tirelessly and selflessly, every moment of every day to provide clinically excellent, compassionate, personalized, safe care for every patient, every loved one, and they've cared for one another. I also want to emphasize, for anyone who needs care, especially if it's potentially for a serious illness or injury, don't delay getting the care you need. We have enhanced safeguards and state-of-the-art screening and infection prevention practices in place to ensure safety, clinical excellence, comfort, and healing. We continue our COVID-19 readiness and response plans to both eliminate the spread of the virus and to immediately surge, if necessary, to care for an influx of patients should we experience that. And we continue to lead Pensacola and the Panhandle in providing COVID-19 testing, including at our multiple drive-through locations. As we continue to work in close partnership with local, state, and federal authorities and health officials, we also need your help from everyone across our community. You can help by following the guidelines that we've been encouraging you to follow all along. Wash your hands frequently, maintain appropriate physical distancing, and wear a mask in public to protect others. This is a public health safety measure similar to safety standards we follow every day, like obeying traffic laws. This is no different. Take care of each other. Don't leave home without a mask. This challenge is far from over, but I'm confident that we'll get through this together and emerge smarter and more unified as Floridians than ever before. And again, we thank you and welcome you, Governor DeSantis. And now it's my pleasure to introduce the president of Ascension Sacred Heart Hospital here in Pensacola, Dawn Rudolph.
Thank you, Tom. I'd like to echo actually what Tom said, and thank you, Governor DeSantis, Mayor Robinson, and all of our local and state leaders and our healthcare workers here today. This pandemic has been unlike anything any of us have seen in our lifetimes, and we thank you for your leadership and collaboration as we worked through it together. To all of our healthcare professionals and essential workers everywhere, thank you for all that you continue to do. We know that it's not easy, especially for those that are in the front line. And I also especially want to thank everyone at Ascension Sacred Heart, Pensacola, for their tireless, selfless devotion to our patients and their loved ones. To our Ascension Medical Group staff here in Pensacola, thank you for your commitment to being the first to set up community-based drive-through COVID-19 testing and for continuing to do it today. Thanks to you, we've conducted more than 13,000 tests since we started back in March. We are grateful for our wonderful laboratory staff who enabled us to quickly begin analyzing tests in-house so that we could reduce the turnaround time and preserve PPE. We've been blessed to be able to assist other community hospitals and facilities across the region with quick analysis of their COVID-19 samples. I want to emphasize this. If you feel sick or have come into contact with someone with COVID-19, go get tested and quarantine until you get negative results. This is an important step to help us contain this virus and protect our healthcare workers. You've probably heard this a lot, but it's worth repeating. If you need emergency care, whether for your adults or for the little ones, do not delay. We are here and we're open to safely care for you, just as we've always been, especially in cases of stroke and heart attack, and don't let the concern about the virus keep you away. We are here for you. Again, thank you to our staff, to government and public health leaders, and to this wonderful community who has supported us and had been alongside us throughout this entire fight. We appreciate the collaboration. We all have to be in this together to keep our community safe. Thank you. And now I'd like to introduce our Chief Medical Officer for Ascension Sacred Heart Pensacola, Dr. Peter Jennings.
Thank you, Dawn. First and foremost, I want to thank all the doctors, nurses, and many wonderful caregivers and support teams within the community and across Ascension Sacred Heart. And thank you to the governor, the mayor, and our community as well for all of the support. Our state has seen a notable increase in COVID-19 cases in recent days. But there are steps that every single one of us can and should be taking to stop the spread of this virus. No matter your age or your health status, everyone needs to take this virus seriously. It can be unpredictable and impact people of all ages. Here are some steps we must take right now to stop the spread. Maintain social distancing. Keep at least 6 feet between you and others when in public. Don't gather in crowds. Wear a mask in public, especially if you're in an area where you can't social distance. I wear one to protect you. You wear one to protect me. As Tom said, this is a public health decision. And the latest research has shown that when everyone wears a mask, it can cut down on the likelihood that you will get COVID or give it to someone else, especially the most vulnerable in our community. I can't stress the importance of this enough. Wash your hands frequently with soap and water for at least 20 seconds each time, especially before eating, after touching anything, and after being in public. Have hand sanitizer with you in case soap isn't available. When coughing or sneezing without a tissue, cover your mouth and nose with the inside of your elbow. Don't touch your face. Stay home if you feel sick. Keep surfaces clean and be sure to give disinfectants the adequate contact time with the surface to ensure it's properly cleaned. Disinfect frequently, especially on those items that are frequently touched, such as grocery carts, car keys, doorknobs, door handles, and shared surfaces. If you have symptoms of COVID-19, get tested immediately and stay quarantined until you have a negative result. It's going to take all of us working together to stop COVID-19 from spreading. But we can do this. We can by following these guidelines and any other guidelines from the government and health officials, as well as advice from infectious disease experts to help stop this highly contagious, deadly virus from spreading. Next, I'd like to introduce Dr. Jason Folan, Pediatrician-in-Chief of the Studer Family Children's Hospital.
Thank you, Dr. Jennings. As everyone has said, thank you, Governor DeSantis, for his leadership, and to all our government and public health leaders. And a special thanks to the caregivers and essential workers who have never wavered in their dedication to providing great health care. One common misconception about COVID-19 is the notion that the virus only affects older populations or that it's only older people who are at risk of dying. That is simply not the case. While the virus does appear to impact older individuals in more and different ways, the reality is that we have seen younger people contract the virus and die from it as well. And this is really important. Even if you get the virus and do not show symptoms, you can still pass it along to your parents or grandparents or any other loved ones who are in more vulnerable groups or have pre-existing conditions. Wearing a mask protects somebody's grandma and grandpa. So we all need to take this seriously and think about how our actions can not only negatively impact our health, but can also negatively impact the people around us. Now is not the time to get complacent. The virus is here, and we all have to work together to keep ourselves and everyone around us safe. Finally, I want to reassure all parents that we are here for you at the Studer Family Children's Hospital at Ascension Sacred Heart. We have safety protocols in place to ensure your safety should you need us. So if your little ones need care, please don't delay in seeking it. Thank you.
Well, great. Well, I appreciate everybody. Now, Tom, you said, if you need care, come in. Can you explain what differences you saw? I mean, obviously, when we got into March, The elective procedures were suspended, but I think you guys, everybody saw a decline in people coming in for things like heart and stroke. Describe that, and have you seen it rebound back to normal levels?
Most definitely. So we really saw numbers, and most hospitals did, saw numbers in the emergency departments drop pretty significantly. And folks that really needed to access care emergently were deferring or electing not to, or ignoring, or wanting, out of respect for the busyness of the hospitals as a result of that. And so too with folks with mental and behavioral health needs that were deferring care that they needed. And we saw, an increase in untoward events with individuals with mental health issues. And so that is one of our key messages. If you need care, we're here for you, and you need to get the care you need as soon as possible so the illness or the disease does not progress further. And we are seeing a rebound in volumes through our emergency departments. We are seeing folks begin to come back. We're still, of all the areas of the hospital, the emergency department is the one that we still have not seen volumes really fully return to pre-COVID levels, but it looks like folks are getting more comfortable and having more confidence that their health system can keep them safe throughout their care. And that is the message that we want. We are here. We can take great care of you. The last thing you need is to delay care that you need to get urgently. As Dawn said, if you're having symptoms of chest pain, the worst headache that you've ever had, shortness of breath, those types of things really need treatment urgently, and we're here for you, and we want you to come get the care you need.
I think in March and April, some of the reason people didn't come is because they were worried that they would catch the virus in the hospital and then obviously suffer negative consequences as a result of that. But then there were also other people that thought, well, the hospitals don't have any room, because there was a lot of that in the media at the time about hospitals being overwhelmed. So I think they just said, look, I have something, but I'm just going to wait because I don't want to impinge or use up any resources. But you guys have capacity, and so the message is, you can treat all comers, COVID and non-COVID, correct?
Absolutely correct. We will keep you safe throughout the course of your care, and we have plenty of room. We have plenty of capacity, and we're here for you.
Great. Dawn, can you talk about some of we were talking about the testing, particularly lately with the younger people, how that's gone, and how that's been driving the numbers, because I know you guys are testing a lot now.
Right. In our mobile site testing area, when we started out, we were seeing a little over 100 people a day. And we encouraged people to come even over the weekends, and then we scaled back as we saw the community testing need decline. But then over the past couple of weeks, we've really seen a ramp up in number of tests, to the point where I believe on Friday we got up to about 500 coming through our mobile test site, and had to institute new processes just to get people through, so we weren't backing up on Bayou Boulevard. So it's been young kids at the early of the part of the week, and then as they go home, maybe parents are coming in, and so yes, we've seen families coming together to get tested.
And have you seen a lot of families, all like a family unit test
Yes.
positive living under the same roof? Is that
Exactly
pretty common?
right. Yes, sir.
And the younger kids, are they testing positive at a higher level than the average person coming in maybe 3 or 4 weeks ago?
Yes, we've seen a definite change in that.
Can you talk about, Dr. Jennings, the acuity? We had talked about the types of patients you were seeing March and April. Now, some of the patients now statewide, a lot of people say they're a little bit milder. Has that been your experience here, and what do you attribute that to?
Yes, absolutely. So our overall positivity rate for the mobile testing site has been approaching 20%. Tends to be younger individuals. Those individuals tend to be the more commonly hospitalized patient now, as opposed to the elderly individuals that we saw in March. Those elderly individuals frequently had comorbidities, heart issues, lung issues, et cetera, that really complicated their overall disease severity, where they ended up in the ICU. We're not having nearly the ICU rates that we had in the past.
And you attribute that mostly to there being the younger demographic that you're seeing?
Yes, sir.
Yep. And then, Dr. Fullen, you had made a point about just how viruses work as respect to that earlier. Can you talk about maybe what that may have contributed to?
Yes. So we do know viruses, and particularly this virus, is mutating over time since it first entered into China. And I think what's happened is that the less aggressive virus is the one that's spreading throughout the community. People who, in the beginning, who were getting sick and dying weren't spreading the virus. And on top of that, elderly populations were isolating themselves. So we're seeing maybe a less virulent or less strong virus spread throughout the community in a population that doesn't have a lot of symptoms, such as the 18 to 30-year-olds.
Are you guys testing everyone who comes in for treatment now, or how is that working at this
Everyone
hospital?
that's coming in for a procedure, for an operative procedure, is being tested a few days in advance. Folks on labor and delivery are being tested, so yes. Not every patient, but certainly those patient populations are. And nobody's having any type of procedure without having a negative test in front of it.
So if they're positive and it's not necessary, it just gets postponed?
That's correct.
And
Yep.
then if you're labor and delivery, do you just move them to like the COVID wing and then they give birth, or how does that work?
No, they're there on the labor and delivery unit and cared for with all the proper PPE, and
Negative
they're
pressure
isolated.
and all
Yeah,
that.
that's correct. That's right.
And then if somebody gets into like a car accident and then they need care, are you also swabbing and testing that individual?
Yes. So when a trauma patient or an unexpected emergency enters into the hospital, we swab them right away. And while we're waiting for the swab, we put on all the proper protective equipment. And then if they are positive, they are isolated similar to anybody else, even though they did not come in primarily with the symptoms of COVID.
If it can wait until you get the positive test, or the test result back, then the procedure waits until the test result is back. But if it's emergent, such as a trauma, Dr. Folan's absolutely correct. Proper PPE is worn by the caregivers to protect the caregiver.
And when did you start testing? Because I remember in March, my wife and I were in, she had our daughter was born, and she did not get tested. I mean, I think obviously the testing capacity was a little bit different. And then we put in the elective surgeries at the beginning of May. Was that when you did the elective surgeries that you decided to make sure you're testing people? Or when did that? Because we're seeing that throughout the state. We're seeing hospitals. I mean, they're doing a lot of tests, and they're picking up a lot of people who are in the hospital for other reasons and are asymptomatic. And I assume that probably started right when the electives were put back in, but it does seem to be a little bit more widespread, I think, in the last few weeks.
For us, it actually started just after May 4th when we reinstituted non-urgent procedures.
What do you have enough testing capacity in the region here, do you think, in Northwest Florida?
So I believe we do. I mean, we certainly appreciate all the help with public health. You know, they set up the testing site out at UWF. That's been very helpful. They take all comers. Here at Ascension Sacred Heart, we do a screening process and take symptomatic, so it's a nice ability to work together with that. And, you know, this last week has alerted me that I think we might need to have more test sites in the community, because as we saw our tests ramp up here with symptomatic, I believe they also saw the asymptomatic persons wanting tested. So we'll see what next week brings, but yeah, we did see a change this week.
Yeah, no, we've seen huge. I mean, I was going around all throughout May just asking people to go get tested, just because we have all these sites, and it was relatively low traffic. And then as we got into mid-June, then because obviously you started to see more outbreaks, and so then people were really interested in testing. So throughout the state, I mean, we've doubled the capacity of some of the drive-through test sites where they were set up to do 750 or 1,000. Now they're set up to do 1,500 or 2,000 folks going through. And I know there's other folks, there's other places that are going to be doing things. And we have over 40 different sites. The counties all got a lot of money from the CARES Act, and I know some of them are putting more money into having the testing. But we are testing probably twice as many people on all our sites over the last week than we were, throughout all of May. I mean, we had these sites set up really from the beginning of May, and added some throughout May. And it was, very steady as she goes, but nothing major. Now you're starting to see more demand. Of course, our sites, you don't have to be symptomatic, so we're getting a lot of folks coming in who believe they may have been exposed, or their work wants them to go in and they are not symptomatic, but then they test positive. Now, obviously, they can develop symptoms depending on where they are on that road, but many of them are either not symptomatic or simply minimally symptomatic. Any other messages for the community? I mean, one of the things I would just say is that this has been a very relatively mild issue in Northwest Florida as opposed to a place like Miami-Dade County. But I think it's just important to realize that they have been seeing more people test positive, particularly in that younger demographic. And, if you're in some of those vulnerable groups, maintaining, the proper social distance and limiting contact, is a smart thing. The number one vector that we've seen throughout this is the home, because those are the people that you're in close, sustained contact with. And if you're in a situation where you have multi-generational family housing, that presents risks, particularly if you have an elderly resident of the home. So those are things that I think folks should be thinking about. It seemed like that as we got into kind of the end of May, beginning of June, COVID fell out of the news. People were focusing on a lot of the demonstrations, all these other things, and I think folks just assumed, hey, maybe this is gone. It's not gone. We knew that from the beginning. It's not the way these things work. We were able to flatten the curve. We're in a much better place to be able to deal with this now, but at the same time, it's something that you got to remain vigilant over, and I think you're starting to see that more, but particularly in a place like Northwest Florida that's had that's had less impact from this, you could definitely see more impact, if you're not careful. So, but we appreciate, all you guys and all you're doing.